Hi, I'm Dr. Madhu Chopra, and I'm back with another episode of health advice from the very best in their field, the very best advice coming to you, and we try and clear out all the doubts, all the little cobwebs, all the questions that you have in your mind regarding certain illnesses. We'll start directly from your lifestyle. Most diseases are based on what kind of genetic drink, what kind of a person you are, what kind of environment you are living. So today we have with us most eminent Dr. Roshani, who is primarily an endocrinologist, but she's doing amazing work on how to prevent illnesses, how to prevent diseases, and how to make it. She's going to simplify it for you just by making few changes in your life. I would ask Dr. Roshni, please will you introduce yourself and the amazing work that you're doing and how it's impacting our society.
Thank you, Dr. Chopra, for having me. It's an honor. I think the work you all are doing to spread awareness and make these, interviews accessible really does help that from the comfort of your house if you can listen to something and get a little bit of information. So my journey is, as you mentioned, I'm an endocrinologist. I've always been interested in the mind-body connection. And it started pretty early in my life, if I have to really rewind back, was when I was in medical school. I saw two different sort of situations happen with two different patients who got diagnosed with cancer. And I was an MBBS student. I didn't have any ability to help these patients. I was friends and family. And I saw one person really struggle and passed away very rapidly. And one person fought through and sort of pulled off another 10 years. And in spite of being in metastasis level 4, stage 4, they just kind of kept fighting. And it just sort of put a seed in my mind is I could see that maybe emotionally there was a difference in how they took the diagnosis. And of course, not to blame anybody, it's a very devastating diagnosis. But I just put a seed in my head is there something that can be done with the mind that could help the body? What could be done with our habits that would help the body? And as I went through my medical training, I figured that endocrinology was about hormones, and hormones directly get impacted by how you think, your stress hormones, how you live your life, it directly impacts your hormones. And so that became my chosen field where I actually wanted to be a psychiatrist, and I spent a year doing psychiatry because I wanted to work on women. And I realized that through endocrinology, I'm able to address the conditions of the body, but definitely keeping that mind focus in place. So I realized that the endocrine training actually taught me how to prescribe medication, make a diagnosis of a disease and prescribe medicine. What it did not really give me was a lot of knowledge in nutrition, sleep management, stress management, definitely no idea about exercise management, fasting, not at all, and just how to make sustainable habits. What we learned through medical training was to give people diet advice is don't eat fried food, don't eat junk food. And just as though, it was almost like unreal for me that, is it true that if I say this to someone, they'll just do it? And they're smart enough to know this. They didn't need to walk in and pay me a consultation fee to hear something that is available on the internet. Is eat healthy and exercise and you'll be fine. I don't think I'm adding any value if I say this. So it was always frustrating to me. And but that was all I saw. Because all we're doing is telling people eat less, move more. And I had a colleague in Chicago. I spent a lot of my career. I did MBBS from Mumbai, Kenya, and then I went on to do my further studies in the US and practiced them for a while. And I have a lovely colleague there. And she kept talking about intuitive eating. Yeah, she kept talking about it. And she used to specialize in eating disorders. And she was all about the relationship with food, intuitive eating, relationship with body. And an eating disorder is an extreme form of it, but many of us have awkward relationships with our body, awkward relationships with our food. Doctors are not trained in this, but she had planted a seed, and so I actually then got very curious that what is this? And I went and got certified in something called mindful eating. And that was like a big change to understand emotional eating, to understand, stress eating, or social pressure to eat, that everybody around me is having something, how can I say no? How can I ask for something else? And these are the things that become the habits and behaviors. And doctors are at the last resort, the reports have gone back. You just have to write the medication. And I just felt like I need to go upstream. I need to go to the root of the problem. So one more thing I did when we were moving from US to India was I got trained as a diabetes educator. Endocrinology, we're the specialists in diabetes. We are the specialists in the hormones, and insulin is the number one hormone connected to diabetes. And I wanted to know the education that my educators were giving the patient. After I write the medicine, what happens behind that door? Because I was about to move back to India after a 10-year stint away. And I didn't want this gap between me and my patient. I wanted to know how to hold their hand and get back to the Indian culture and understand what's going on here. So being a diabetes educator really changed my journey. I started doing education classes for the patients where it wasn't just about one-on-one prescribing, but I would create a group environment where we would teach the patients what they can do with their nutrition, their sleep, their stress management, their exercise, their fasting. And then it has just been 10 years down the road. What I see is it's become a lifestyle first practice where I would be the one who wants to help you have better health with less medication. Hopefully, we started the preventive side. Still, I think people think of doctors when they're already on the spectrum of being ill, but more and more people are getting aware, they're getting conscious that, hey, I would like to take a lifespan, health span, longevity approach, and preventive health approach. So it's been a lot of fun. There's so much we can do to help people change.
Wonderful. I mean, you have covered so many verticals, just not just by being an endocrinologist, but having that seeds on your head that disease are prevented and we prevented people's. So I know that endocrine is a channel. Each of them are playing different channels. One is India, there will be other is affected, the next one is affected. So when you say endocrinologist, do you treat all fibroids, family pituitary, or are you specialized in particular?
Yes, so our training was to be proficient in every single organ system, every single hormone system. When I was working hospital-based in the US, a lot of our things would be about adrenal crisis, pituitary crisis, tumors and things like that. As I branched out into more outpatient medicine, that's where I got more and more interested in what are the endocrine conditions that can be directly impacted by lifestyle. It's much more now my domain to be focused on the lifestyle friendly or the lifestyle influenced, yes, hormone conditions. So now, for example, if someone comes to me with a pituitary tumor or an adrenal tumor, I would refer them to a hospital-based endocrinologist. Now my specialty has become lifestyle first practice.
You said you did most of your studies in the US, especially the nutrition part of it. And did you find it hard to change the mindset or eating habits of Indian people after you moved from US to India? Because their eating habits, their mindset is very different from what we do here. So how was that?
Okay, so definitely it's different, and I guess one blessing was that because I took the educator training, I realized that it's not my job to get someone to change.
Oh.
Yeah. It was a very big difference. Is when you're a doctor, you're convinced that you have to get the patient to comply with your prescription. Compliance is the word. If the patient is not taking the medicine, we have this word like non-compliance, which actually, like the fire department says, this building is fire compliant. There's like rules and regulations. So now doctor patient, this word compliance is in authority. I say and you do. And I've kind of turned that around on its head. It's an empowerment model for me, and that's what I learned from the education space. Is we are here to empower the patients with information, so that they can decide.
Oh, they make their own choices.
They make their own choices. The reality is that as soon as they walk out of my practice, out of my office, they are in charge of their life. So the field of motivational interviewing is a counseling skill and a counseling style that, let's say I want you to change something. Instead of me telling you change, it's going to be more effective if I can engineer the conversation where you are the one telling me why you want to change.
Okay.
So then I don't have to battle you. And it's like if any parent knows, right, when you're telling the kid what to do, which is right for you, this is the right thing for you, instantly the spine goes up. No, because someone else has told me. And that's actually a natural human response. From the age of 2 and 3, you know, the toddlers tie your shoelace. If you say it like that, then the child doesn't want to do it. And if you say, oh, I don't think you know how to tie your shoelace, like the children we play that game, right? In adults, reverse psychology. Now, in adults, we're not trying to trick them, but we're trying to tap into this universal truth, which is the person sitting in front of you wants to do well. If they're doing things that don't match with that, there's probably some information gap, some ability gap, skill gap, but they're not intentionally becoming sick.
Roshani, I have written a book on diabetes and keto lifestyle changes. It will very soon be out on the stands.
Yes.
And could you tell us something about the book? Also with diabetes.
Yes. So the book is for people with type 2 and with type 1 diabetes. There are lifestyle changes in there that would help anyone with any kind of diabetes, because whether you are going to be on insulin lifelong or not, you just, you know, if you're on insulin lifelong, cannot get off, that's type 1. But even if it's type 2, all people with diabetes can benefit from what's in this book, because I focused on what can you do with your nutrition, your sleep habits, your stress management habits, your exercise habits, your fasting, understanding your medications and your blood tests. There's a section on women's health. There's a section on children and adolescent teenagers who are developing all the processed food, junk food, sedentary lifestyle related type 2 diabetes, full blown. And how can parents navigate those conversations? I've even put in a piece on that because it's been exploding in my face for the last 10 years. And I felt there's no way I'm going to be able to reach everybody individually myself. At least with this book, we can try and spread more ideas. And it goes beyond sort of the way we've just been speaking. The book goes beyond telling you, eat this, don't eat this. I don't give out diet plans to anyone. I'm nobody to tell you what to eat. It could be your navigation system. So this book wants to be your navigation system. It's step by step. What can you do to have better diabetes with less medication?
So Dr. Roshani, what is diabetes type 2 and what is diabetes type 1? Why are they differentiated like this? And why do we hear so much about diabetes? Was diabetes tablets all our lives? Situation or something has changed drastically, which is the reason why there's so many diabetes.
Yes.
And what is the relation of what is the question?
Okay, percentage. Sure. So, the naming and the types of diabetes. So, diabetes has been described in ancient Indian texts, ancient Greek and Egyptian texts for a long time. And in Sanskrit, there was Madhu, right? And it was about sweet urine because we didn't have blood testing. It was initially noticed that the urine of these patients was sweet. And initially, the most obvious kind of diabetes was type 1, even when they didn't know what was going on. Because in type 1 diabetes, it becomes an acute condition where suddenly this person is going from being well, within a few months, they're losing weight, they're just getting extremely weak, and they're kind of disappearing in front of your eyes. It's like a wasting syndrome. And the problem in their body was the body had stopped making insulin. They were just not able to get in the nutrition, the carbohydrates, the glucose was not entering the cells at all. There was no energy staying in the body. So it was fatal until they got insulin. So insulin was released for treatment for this condition in 1922.
What's recent of that?
Just 102 years. The first treatment of insulin was, you know, the not cure, but life-saving treatment for type 1 diabetes came then. But for the longest time, we were seeing these children and they would try extreme diets. You know, they would try and starve them or try and feed them extreme diets, try and keep them alive longer. But until insulin came, they were just not able to really thrive in a good way. Type 2 diabetes is the one that is a little harder to diagnose, but it can sit around for years silently until it can get to that extreme level where you're losing weight, you're thirsty, you're peeing a lot. And the initial phase of type 2 is weight gain. Where
The opposite.
Type 1 will present with drastic weight loss. type 2 would be going on for years before diagnosis with progressively that, especially around the waistline, inches coming on. And that is the predominant diabetes that you see. If you see like 100 people with diabetes, I'm not going to be able to accurately say the number, but the majority will be type 2, which is lifestyle related, can be, the word remission, you can turn it around. Whereas type 1, we're still looking for a cure. As of today, they would still need to be on insulin for health, but there are still things you can do to stabilize even type 1 diabetes.
Protein diabetes are so different in their history, the making, the diagnosis, the treatment, everything, right? So, shall we just, in this
Yes.
episode, talk on type 2 diabetes?
Sure.
And how can you prevent that?
Yes.
How can you prevent any this diabetes if it's not in your blood?
Sure.
Then,
No, that's a really important question now. So the catch here is we think of diabetes as a glucose problem. Okay. You go to the lab and you get a glucose level tested, and you think it's a sugar problem. But it's not. It's like saying I have a fever. Now you have a fever, but what's the cause of the fever? Could be malaria, could be typhoid, could be viral. So you have high sugar in the blood. That could be type 1 diabetes, it could be type 2. So what's the difference? The difference of this is at the level of insulin. In type 2 diabetes, you have high levels of insulin. In type 1 diabetes, you have low levels of insulin. So diabetes is an insulin problem before it comes up as a glucose problem. And this is something people don't always understand, because when you get into the treatments, as long as the glucose level is down, they think I'm getting treatment. But if all I give you for your fever, for your malaria, is crocin or paracetamol, am I really addressing the cause of your fever? Now, if it's a viral, it'll wait 3 days. But if it's a true bacterial or parasite, you cannot just give paracetamol to block. You cannot give just paracetamol to block the fever. You have to treat the cause. Similarly, if the glucose is high, you need to treat the cause. Why is the glucose high? And that's what comes to how can you help type 2 diabetes, is to figure out what's making insulin go high. And that condition is called insulin resistance.
what goes wrong with the body? Why is it doing that?
Yeah, exactly. So insulin resistance, now this is where I probably need to explain how hormones work for a minute, is hormones are designed to keep the body in balance. If it's too hot outside, your body will indicate that we need to open up the skin pores, we need to create sweat, we need to evaporate the sweat and bring the temperature down. I need to go find shade. That's all happening through the body sense organs, telling things inside and sending messages to the thirst signals, and all kinds of things happen. Now, if something goes like too much of something, then the body will try and give a negative response to a negative feedback, so that things don't just keep on going there, escalating. But if you exceed a certain capacity, for example, we stay with the too hot outside, up to a point, we can do sweat, we can do thirst, we can go find shade. If it gets extreme levels of heat, that's when we're talking of heat stroke, fatalities, and things like that. So the body has an ability to respond to changes in the environment through its hormonal buffering system, its communication system. If that system gets exceeded or overloaded, that's when things break down. What is insulin supposed to do normally? It's an important life-saving hormone. We all need it. It's an anabolic hormone, so it helps you grow, it helps you build things, which is why in type 1, the children or the young people were disappearing, they were wasting away, because whatever the parents were feeding them couldn't get into the system. It wouldn't enter. So insulin is an anabolic and a growth hormone. You need that. You eat food, it needs to get into your system with the help of insulin. If we are continuously pushing too much high insulin through breakdowns in nutrition habits, sleep habits, stress management habits, exercise habits, there's no concept of fasting. We're eating all day, we're eating at midnight, we're calling online 2 a.m., we're snacking. So there's no break from insulin. There's insulin high all the time. The body's not getting the time of low insulin states. And that becomes, then the body's like, I'm not going to listen anymore. I can't take so much insulin. And we get what we call insulin resistance, where even though there's high insulin circulating, the cells are not responding.
You explain it beautifully. Too much. If you have insulin, why is it removed?
Yeah. So, and then the problem is when you bring this kind of blood work to a doctor, unfortunately, we are sort of trained. Let me put it in a conversational way. Imagine that there's a couple and they're fighting. When they're fighting means they feel like someone's not listening. So then they yell. And when you yell, shout louder, how likely is it that that person's actually going to listen to you? No. So you need to learn how to lower and create a situation where you can be heard again. So insulin resistance and giving more insulin or giving medicines that push more insulin into the system is like yelling louder in a dysfunctional relationship. This is the analogy I use.
Very good.
So we need to come back down to why is the relationship dysfunctional? Why is insulin not communicating with the cells when it's dead? It's not working.
So is type 2 diabetes preventable?
Yes, it's preventable. We're looking at a type 2 diabetes prevention case in the flesh. I had touched pre-diabetes myself, even though I did not have any gestational either of my pregnancies. When we moved back from the US to India, first 2 years, I'll be honest, was a tough adjustment period for me, personally, professionally. I wasn't expecting all this. Yeah, very high stress. And nothing else had changed in my life, but I became into pre-diabetes. And it was a big wake-up call. And yeah, turned things around. And today, it's been more than 10 years, nothing diabetes related in my blood work. I know that had there been a twin version of me who kept on that track, not figured out how to manage stress, kept eating the way I was eating, wasn't exercising, she would have diabetes for sure by now. So I'm the prevention case.
Right.
And there are so many like that in the world. So many.
Can you tell me stepwise how kind of person who has a family history of diabetes, both parents, is it possible for now to prevent that type of care?
It's a great question. You know, I've seen it happen. And I'm Gujarati and got a very strong DNA, which I cannot refund. I can't go and return what I've been given by my DNA strands. There is pre-diabetes and diabetes in my family tree. But I think we have enough in our hands, and it's been proven in research, right? The US government actually 20 years ago has published that you take people with pre-diabetes and you give them lifestyle change versus you give them metformin, which is the initial most popular drug for type 2 diabetes, and you observe them over time. And they found that the lifestyle change group prevented more cases of diabetes than the metformin.
You keep saying